Hello everyone, in this video we are going to share with you all the important treatment strategies that can be utilized to activate the serratus anterior muscle in shoulder impingement syndrome patients. Now we have already done a video on how to palpate the inferior angle of the scapula and using this as reference how to assess for the outward rotation range of the scapular movements that are required for the normal glenohumeral rhythm. We also mentioned about the importance of the movement of the scapula outward so that the acromion can also move along with the head of the humerus, avoiding the impingement of the subacromial bursa and the supra and infraspinatus tendon. Now for this it is important that the serratus anterior muscle works properly and stabilizes the scapulothoracic joint during the outward rotation and elevation movements. Also, the researchers have proven that the hypoactivity of the serratus anterior muscle, which is lying deep along the anterior surface of the medial border of the scapula, as well as the hyperactivity of the upper trapezius muscle fibers, leads to improper incoordinated movements of the scapula during the shoulder elevation movements, and this result in shoulder impingement syndromes. So in this video we will be focusing on the important strategies that can be utilized to activate this hypoactive serratus anterior muscle. So let's get started. Now one important test that I would like to share with you all that actually confirms that serratus anterior is not working properly is the scapular assistance test. And the best way of doing it is to stand on the side of the patient that is affected. Normally what we see is as the patient goes into the shoulder elevation, there is a sudden impingement and pain, which is also referred to as the painful arc. Now what we need to do is we need to just hold or stabilize the medial border of the scapula with our hypothenar eminence and follow the shoulder elevation movement and actually assisting the scapular protraction movement. And if assisting the scapula results in no pain, this means that actually the serratus anterior is affected. Now as we all know that serratus anterior is also known as the boxer's muscle and it is a strong protractor of the shoulder joint. So the first treatment tip that I would like to share with you all is to start with your rehabilitation program in the close kinematic chain. So this helps in gaining more proprioceptive input from the shoulder joint and the weaker muscles are fired more easily. So here I have made the patient assume the quadruped position with the hands directly under the shoulder joint and the knee directly under the hip joint. Now from here the therapist needs to first educate the patient about the movement that needs to be trained. So what Tanmay I want you to do is to take your both scapular bones closer to each other without bending your elbows. Very nice. And now take them far away and up. So this is the movement that actually needs to be first make the patient understood. Now what is important to observe is that once the patient goes down, this causes the scapula to adduct or retract, and once the patient comes back up, it causes the scapula to protract. So now to design the exercise, what we need to do is we need to engage the serratus anterior for all three types of muscle contraction. So what we can find here is once the patient is going down but in a controlled manner, it is actually causing the serratus anterior to fire eccentrically, and once the patient is coming up, it is causing the concentric contraction of the serratus anterior. And if I ask the patient to hold your position and do not let me push you down, this is actually going to cause the isometric contraction of the serratus anterior muscle. So to start with the exercise, I am going to keep the inactive or weak serratus anterior in the shortest possible range. So for this I am going to take the patient into the hyperkyphotic spine, and from here I am going to ask the patient to hold your position, and what I am going to do is I am going to try and bring the scapula into adduction from this side as well as from the normal side. So this side is going to help us in irradiating the weaker side serratus anterior muscle. So now hold this position. Do not let me push you down, and bring your scapula in. Hold, 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 hold. So this is the isometric contraction, and once I find that patient is able to resist, now I ask the patient, okay, now go down, but slowly, but slowly. So this is going to activate the eccentric contraction, and now come back up. Very nice. And this is going to activate the concentric contraction of the serratus anterior muscle. Now, once the therapist finds that patient can actually fire the serratus anterior for all three types of contraction in this position, the progression can be in two ways. Again, keeping the joint in close kinematic chain, but gradually increasing the range of shoulder flexion by shifting the hand forward and progressing the same type of exercise, that is going down in a controlled manner and coming back up and holding the position against resistance, or keeping the hand under the shoulder and moving the knees back. So in both cases, what we are actually trying to do is we are trying to activate the serratus anterior in the greater ranges of shoulder flexion movements. Now the next progression for the training of serratus anterior should be to start with exercises in the modified kinematic chain. So what we want to emphasize here is, no matter what exercise is chosen, the initial and most important thing that should be kept in mind is always start training the hypoactive or the weak muscle from a position where the muscle is in the shortest possible range. So instead of training the serratus anterior, as we see in many exercises, asking the patient to go up and down. So again, we are activating on movement of the scapula in the outward direction with stabilization, again firing the serratus anterior. A much better way is to passively take the patient into the end range, assisting the outward rotation of the scapula, and then asking the patient, okay, hold your position and do not let me take you down. So what this is going to do is, this is going to engage the serratus anterior isometrically and gaining lot of proprioceptive feedback for this particular muscle, making the patient understand, okay, this is what I need to fire upon, and then asking the patient, okay, now I need you to come back, but slowly, but slowly, but slowly, keep going, keep going, keep going, and again go back up again, and I'm going to resist this movement. So again, I am training the weak serratus anterior for all three types of muscle contraction. And then only the therapist should plan or prescribe the free or open kinematic chain exercises for rehabilitation of the shoulder impingement syndrome patients. So this was the important strategies that I wanted to share with you all. Use proprioceptive feedback, use close kinematic chain activities, follow with modified kinematic chain, utilize all three types of muscle contraction, and ensure that the weak muscle is first rehabilitated in its shortest range. So I hope the information shared in this video is going to be helpful for you all. The same strategies can also be utilized in treating various other musculoskeletal disorders. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.